Okay. Good morning, good afternoon, good evening to everyone. Thanks. I'm so glad to see such a great turnout for this event. This event is the third in our series of accessible meetings. The Accessibility SIG has been doing, since COVID happened, we've been trying to do a series on different events on what are the challenges for people with disabilities in coming to meetings where everything is virtual. So we've had, this is the third in the series. Last event previous to this was last month, where we talked about accessible documents, which has now been a huge problem, especially where people are trying to digitalize everything, and scanners seem to only take images anymore because of some copyright restrictions, that you then have to get an OCR afterwards to make them accessible. And now, and people, because of bandwidth issues, are not turning on their video, and so people can't lip read. When we have masks on, people can't lip read. So there's a whole range of issues that are problematic. And so this session today is talking about the impact of COVID and on virtual meetings with the people who are deaf or hard of hearing. So we look forward to having the discussion. We have several panelists here. We have Kristen Vogler from Gallaudet, who has a technology center. We have Mark Wheatley, who heads up the European Union for the Deaf. Hopefully I got that right. And then Lidia Best, who I worked with many times on DCAD, and she's also the co-head of the ITU disability section, which human factors. It's just a long name. I can never really remember it. And so I would let them go straight on to them. Our interpreters today are Sandra and Amanda, and our closed captioners are from Caption First. And I will post the link into the chat if you want to see the stream text link. But let me go straight then to Christian, and look forward to a great discussion.
Thank you. Hello, everyone. My name is Christian Vogler, and I work for Gallaudet University in Washington, D.C. It is a university designed for deaf and hard of hearing administrators, and I'm the director of the Technology Access Program, which is a research group that focuses on communication access for the deaf and hard of hearing. Our research touches on a variety of things: technology support, language and communication, lip reading, listening, everything. It's a really holistic approach. We're involved in video conferencing, telecommunications, captioning, video, and a whole lot more. Today, I'll be focusing on video conferencing. We all know, ever since COVID-19 began, there's been a huge impact on how people communicate with each other. And a lot of new challenges for deaf and hard of hearing people have arisen. And it's interesting because we predicted 10 years ago that online collaboration would start to appear. It was between 2009 to about 2015, my group collaborated with others to research accessibility issues when people gathered online for meetings. That research has been funded by a grant. The same grant that's paying for the interpreters today, actually. We have identified several different challenges that deaf and hard of hearing face and other disability related in these platforms. And we're going to touch on those challenges a little bit later. The most important thing that I wanted to tell you today is to make meetings accessible for deaf and hard of hearing people. It's possible, we've actually developed some guidelines on how to successfully do so. And I'm going to put them in the chat box so that you can have access to those guidelines. We've also developed an experience report for each of those experiences, how deaf and hard of hearing people are experiencing conferences. ACM Assets 2020. We've also written up and published in that paper there. It's open access and you can download it for free. We've also looked into a variety of different type of video conferencing platforms and compared the accessibility options for deaf and hard of hearing individuals. So I'm going to pause for one moment now, and I'm going to add 3 of those links in the chat box so that everyone has access and can start to look at them as you need to. Okay. The big picture is that there are many video conferencing platforms out there with uneven support. So there are some that are very accessible, some are less accessible, and we see a variety. We've identified some common issues related to platforms. The 4 common issues that we see happen quite frequently are, number 1, the video quality itself. If you're on video, you should be able to watch the lips of a person and or the interpreter signing, and then have a slide share also independently and have both of them work. It's very important for the deaf and hard of hearing person to be able to see the speaker at the same time as seeing the slides they're presenting from. And many platforms make it hard to do so. One platform, you share the screen and the person gets very small and the PowerPoint is very big. You can't see the person clearly. If you try to make the person big, then the PowerPoint is smaller. What's really important is to be able to see both of those screens at the same time. At some level, that needs to be supported. And then what's happening again and again is many video conference supports. You'll have a lot of people who are attending the meeting. So a lot of different videos will be on the screen at the same time. And for deaf and hard of hearing people, as I mentioned, it's important to see the speaker and the interpreter. And when there's multiple attendees, you need to be able to pin those individuals. You need to be able to pin sometimes 2 or 3 people at the same time. And on some platforms, it's hard. On Zoom, it's pretty complex. Now you can pin multiple people at the same time. I've also seen that many platforms don't support captioning. For example, many platforms can't integrate captioning, human captioning that is, at the same time as the video is running. Sometimes the captioner is not available, and so instead there is automated speech recognition, which produces the captions automatically. And so that type of automatic caption services is okay, but it does not compare to the quality of a human captioner. It's okay if someone is there last, if we don't have anything last minute, automated speech recognition is better than nothing. Okay, and when I look at the platforms, only about 1/3 of all platforms available on the market support captioning at all. So that means 2/3 are not supported. So accessibility ranges. And I want to emphasize that there is no one platform so far that meets all of the needs for deaf and hard of hearing people. So you have to prioritize which option is the most important for me, for example, as the deaf and hard of hearing user. So I have to establish the meeting so that I can use the option about which platform is the best fit. And I think that it's important for you to talk with your deaf and hard of hearing participants, ask them what they prefer, what works for them, and try to accommodate those needs. I also want to emphasize that some platforms have different options for captioning, provide an option for pinning videos. However, implementation of the options is not that great. Sometimes implementation, it's just hard to use or becomes confusing. So it doesn't necessarily check all the boxes. You have to investigate not only are the options available, but are they usable, user-friendly? For example, Zoom, as I already mentioned, you can pin multiple people, but it's pretty complex. If you look at the options on Zoom, it says pin multiple people, but not everybody uses that practice. Generally, meeting online platforms are designed for hearing people. The priority is not video, communication by video. The priority is to be able to listen through audio means and communicate that way. That means deaf and hard of hearing people have had to be very creative and come up with workarounds for some of the problems that face them. So one common thing is that we have a separate video call with the sign language interpreter, completely separate from the meeting. So I'll join, for example, a webinar, and then I'll join another video conference with the interpreter. So I'll join the webinar so I can see my other coworkers, colleagues meeting, and then oftentimes I will communicate and join a FaceTime call with the interpreter. And that's how I manage communication. And that works. But that's not fair for the deaf and hard of hearing person, that extra burden. That requires them to have an extra device, another computer, a computer and a laptop sometimes. And so from the perspective of someone who is deaf and hard of hearing, we're buying more resources, we're buying more equipment and investing just so that we can join a meeting at the same level as my hearing colleagues. So if you're going to invite a deaf and hard of hearing person to your meeting, and now that you're aware of these issues and these challenges, please make sure that you establish meetings that are equitable. I've talked a lot about technology so far. One of the most important things that I want to talk about today is that technology is only about 20% accessible. And the other technology focuses on human behavior and how people participate in meetings. So technology is important, but 80% of the accessibility really comes from how people can participate in their meetings. For example, developing strict communication rules for how people take turns. That's another way to make your meeting accessible and to make sure deaf and hard of hearing people are participating and not behind. So establish some ground rules like hand raising. Use the chat box. Make sure that deaf and hard of hearing people can participate when they want to. Give them a chance. So identify those people who are speaking. That's another behavior that can allow deaf and hard of hearing people to attend the meeting, just like everybody else. Identify who's speaking. Have a strict policy for when you're not speaking, your video should be turned off. So if someone is speaking, their video would be turned on. And when they're done making their comment, they turn their video off. It's the same concept as having a microphone. And when you're done speaking, turn the microphone off or give it to somebody else who's ready to speak. Because turning your videos off is one of the most important things you can do. Turning videos off when you're not used it just solves so many technical problems. So not only is it a behavioral fix, but it also fixes a lot of the technology issues. And then another thing I want to emphasize is that if you're planning a very large, important meeting, get together and practice first. Look at the technology, figure out what accommodations you might need, and then implement them and practice. I can't say that enough. Practice, 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 and be organized. If everyone is familiar with the workflow, what the ground rules are, how you'll be taking turns, then your meeting can be run smoothly. Those guidelines that I've already shared in the chat box, that's where you can find them. The guidelines are available for you to develop partnerships with deaf and hard of hearing consumers and advocacy groups. The National Association of the Deaf, the Hearing Loss Association of America, and many other associations have been involved in these guidelines, developing these guidelines, so that, and have been developing them for years. So if you're going to host a meeting, I really encourage you to read those guidelines, know them, and please follow them. If you talk to deaf and hard of hearing people today, a lot of them will let you know how to set up a meeting. But in practice, people won't, they'll say that they know it, but it seems like they're ignoring what they're knowing. And just listen, be humble. If you don't know, say you don't know. Listen to people who know their experience better. And then, as I said before, practice. You'll have a much better experience. One last issue I'd like to mention this morning that I think has become very important. Ever since the COVID-19 pandemic began, we see a lot of video conferencing. Plus, we know that schools are all virtual. And that's had a large impact on interpreters and captioners and their availability. There's a lot more people that are asking for interpreters and captioners. And that's a very positive thing. It's fantastic. At the same time, because demand has now increased significantly, we know that there's a shortage of captioners and interpreters. We simply don't have enough to meet the demand. And so we need to come up with strategies, and we need to plan ahead. If you're going to have a meeting in January, for example, start working on accessibility. Hire a captioner and an interpreter now. Don't wait until the last minute, because they're in high demand.
It's okay. It's okay. He's reading.
Okay, I will wrap up now with some key points about making an accessible meeting. 80% of accessibility is all about human behavior. 20% is all about picking the right technology and the right platform. Make sure you work with your deaf and hard of hearing participants. Ask them what they need and accommodate their accessibility needs. Thank you so much for your time this morning. I'd now like to turn it over to the next speaker.
Hello everyone. It's wonderful to be able to speak to everybody and share the perspective specifically from the deaf and hard of hearing people perspective, those who do not use sign language. And this is afternoon in London, very nice and sunny, and I would like to just recap who I represent today. I am the chair of National Association of Deaf People in UK, and also a vice chair of a joint coordinating activity on accessibility and human rights factors at the International Telecommunication Union, JCAA-HF. And I also have spent 10 years as the board member of the European Federation of Hard of Hearing People. So I would like to first introduce a little bit what it was before COVID and what it is like now. While everybody else knows the difference of moving altogether to online meetings, there is a very different kind of motion of how this affects persons who are lip reading mostly. Many of them didn't feel that there is a need of doing any kind of technology upgrades, etc. They relied on face-to-face meetings. Having any remote kind of participation has not really been particularly used in any kind of ways as we are using right now. I mean, a few years ago, I was exposed for the first time to the motion of having remote captioning and remote participation accessible to me. So the exposure was not there. I think sign language users were more already using some of the technology, such as FaceTime, and different ways of accessing video relay services. So this was a huge shock for many people when suddenly that face-to-face communication did not exist anymore. We all had to move to online meetings. Now, online meetings are great too. Like now, everybody can actually enlarge the picture and video can see me clearly and be able to lip read me well, given the good video. But the problem has been, as Christian has mentioned a lot on technology, but one of the things I have observed and my colleagues have observed is that it's not just about the organizers and the organizations which are providing the remote meetings, which they are, of course, important and points have been very well presented by Christian, but it's also about us, how we are now going to find the way of interacting with the technology, how comfortable we are with the technology. It was a sudden massive shift from not having to use technology because of choice to not having any choice, but having to use the technology. So for many people who are especially older with hearing loss, it has been even harder because suddenly they had to upskill themselves in a technology which they were never comfortable with. So for National Association of Deafened People, we have recognized this need. And at the beginning of the lockdown in the UK, we have worked together, and I also worked with Christian, and I am grateful for Christian's support, who made sure that I have all the up-to-date information to provide our members with the information such as what is the stream text, there is existence of remote way of remote captions, what we need to tell, how we can help the organizers in terms of accessibility. Because what we have found as well, some organizers would like to organize event accessible, but they had no understanding of how to do it. So in some ways, I had this kind of joke that if you mention accessibility, remote captioning, or sign language would be easier in the way. And for some people would just run to heels. Oh, we can do it. And it's about, like Christian said in his final words, work together with us. Recognize as well that we can be experts. So what we did with our leaflets, which I will later share with you, we have given a very simple way of understanding what can be done, what is possible for us as the users, and also for the organizers. One thing which we didn't really much talk about, Christian didn't mention some of it, is cognitive overload. Now, normally, a lot of people who are in the circles of hearing loss are talking about listening fatigue. Well, with all the move to online meetings, there is another additional one, cognitive overload, cognitive fatigue, and it does come up, especially for people with hearing loss. So if, for example, the video is not working very well and is not good, it's very hard because suddenly we have to put an extra effort of trying to understand what this person is saying. If a person is not positioned properly, even with a great video, it's again another barrier, it's another strain, another effort to be taken. There are lots of different ways of relieving it. Of course, is the captioning, but also one more thing, breaks. Regular breaks for everyone. So let's say after an hour meeting, give everyone 5-10 minutes break. It's important to be able to just, to get away from the screen and to be able to recharge your batteries in some ways. Now, I did say that lots of people not necessarily don't want to provide accessibility. it could be because they simply don't know. However, from the beginning of lockdown, beginning of pandemic, there were so many different examples which I came across in UK, across Europe as well in the world, where organizers who used to be providing accessibility on on-site meetings, unfortunately suddenly decided that they have no funding, or they didn't want simply to do this kind of accessibility anymore online, or they didn't see the need for it. And it's been very hard to work against those kind of preconceptions and pointing out as well that what can be done. Often, the best excuse probably I have heard from many people is, oh, sorry, technologically it's not possible. We are experts. When I receive this kind of response, I know technologically lots of things are possible. Even if a video platform is not allowing remote captioning in the platform, it can be done outside. We are already doing it today. So these kind of excuses are really not anymore a good excuses. Let's just say that. What I wanted to say is, there is also another reason why some people, especially companies where deaf and hard of hearing people are working, depending on the level of security they are working between, they will accept telephone calls and video calls between the actual video platform, but sometimes they refuse remote captioning on base of security. And we have worked with some of our colleagues in UK to help them out to get around all of these different kinds of issues and concerns. So the education goes both ways, the users and the organizers. What I would like as my last one of my last points is, at International Telecommunication Union, we have been using remote participation for many years. And in 2015, new technical report has been published, and it is free to download, free to access, and it's called Remote Participation. The offer meetings technical paper, it's called Accessible Meetings. So there are quite a few things, and right now we are updating the document to make sure that they are reflecting all virtual meetings. Everybody is in the virtual meetings, and it should be available hopefully by next year to everyone. So there is a lot of work going on. It's a huge wake up for everyone, but we no longer can lead the life, carry on as we used to. We need to now change in many, many ways. And I would like to say once again, thank you very much, Christian, for all your support and help. Without you, I would have struggled. Thank you. And I'm passing this on now to Mark.
Hello, everyone. I'm here today with you in Europe, coming to you from Belgium. And I want to say good afternoon to everyone.
How do I do? It's done.
I am the director of the European Union for the
Darren, that's Darren. He's up the
EUD.
top.
Okay.
And we have 31 countries that are participating in our organization. As we all know, the coronavirus pandemic has had an enormous impact on our life as we know it. Since March until now, there has been a huge shift in how we approach meeting people, how we approach communication. Pre-coronavirus, we would go to somebody in person with an interpreter, for example, and using that strategy, be able to have a conversation. And then in meetings, the same sort of scenario would happen because we were in person. But now, immediately, things have needed to shift. And it seems like we're able to, it's much more fast-paced. Meetings are fast-paced. Our approach is much quicker. Things have changed. Now I'm using ASL, or I'm trying to communicate with you in American Sign Language. But here in Europe, we use International Sign. And that is how we communicate. Using International Sign, the International Sign is different. It takes sign languages from all over Europe. And that is how people from different countries communicate with one another who are deaf and hard of hearing. International Sign requires a lot of feedback. It requires a lot of attending to your conversational partner and adapting your language to fit that unique experience. And that's easier to do in person than it is online, because getting that nuanced feedback online is difficult. You know, any deaf person who's using an interpreter knows that they're using cues too. There are nonverbal cues that give them a lot of information about that conversational situation. There are nonverbal cues, there is body language. All of those things help deaf and hard of hearing pick up on social cues in person, but you don't have that in an online platform, in an online environment. You can't even point to somebody because everybody's in different spaces, depending on their point of view. So before COVID-19, we would have meetings, of course, in person. I'd go to different countries and attend meetings with large audiences. But now, since the pandemic started and since certain countries have locked down, most of the meetings are conducted through webinars. And that's an incredible achievement. One positive about webinar is that more people can join a certain event. Accessibility is greater. Nobody needs to fly, travel, pay for travel. Those aren't barriers anymore. People can stay right in their homes and attend a meeting from far away. That's a big shift. However, it's not all positive. Other issues have come up. Christian Vogler and Lidia, the two presenters before me, have already mentioned several issues they've been facing: planning for interpreters, how to make online platforms accessible, working with captions and captioners, making sure you book some of these professionals, interpreters and captioners ahead of time. We're learning about all these issues. And one good thing about that, this is a learning process for all of us, and being professionals. I think what's really interesting about interpreters, think back, we've had for some time now video relay service, or what we call VRS. And that experience with video relay service, as deaf and hard of hearing people, we know what to expect. The interpreter will come on a screen. They will be appropriately lit. They will have a background that is in contrasting color. But now, since coronavirus and everyone is, locked down at home, the interpreters have had to go through a learning experience just like everybody else to make sure that they are providing the best services that they can for the deaf and hard of hearing consumers. Christian Vogler was very clear in outlining the challenges, and I wanted to add one more. Interpreters are not speaking at the same time as the person they're interpreting for. There is a lag behind any interpretation. And that time difference, whether or not it's, a few seconds, can still create challenges for someone who is deaf and hard of hearing who's trying to participate in a meeting. So you can imagine if an interpreter is interpreting for someone who's speaking English, the deaf and hard of hearing person wants to involve themselves in the conversation, wants to add a comment, but because the interpreter is behind the spoken part of the communication, the deaf person often doesn't have a cue when to join a meeting or when to join and add their comment. Since coronavirus has locked us down and forced so many of us to work from home and work on Zoom and other platforms, it's actually given us a taste of what's possible. What's possible in the future when we think down the road next year and beyond. Vaccines now show to be effective at 95%. So in the future, we can see a day where coronavirus will not be here. Does that mean we all go back to face-to-face meetings? Or does Zoom live on? Zoom is immediate, it's cheap, right? There's a lot of, you can save time, save money, resources. Will this create a permanent shift? As Lidia mentioned, there is eye fatigue, other types of fatigue. I know as a deaf person, it's very fatiguing to watch an online video conference all day. I have to take breaks, I go outside. You know, and I know that when we're face-to-face, you can even take a break during the meeting and it makes it much more enjoyable. This is a very interesting shift in how we approach gatherings and meetings for professional purposes. Does this make a permanent shift? As Christian Vogler previously outlined, lots of accessibility issues. If we can get those accessibility issues taken care of, we can check all those boxes. One might ask, why do I need to physically go to a meeting anymore? Maybe Zoom will stick around. Zoom has improved on a lot of different fronts. We know that now we can pin multiple people. We have captioning available. So technology is really quickly adapting to the needs of people in an online environment. The impact for our work, you know, for example, I mean, we might be working better. It's a negative impact in the sense that we do want to be with one another, but it might have a positive impact on our work. So that's all I'd like to say for now. Thank you, everyone.
Oh, let me just turn my video on.
And I'm not sure who's the next.
I don't think.
Oh, there you are.
Yeah, sorry, I hadn't turned my video on. So thanks so much, Mark, for your things. I don't think what we wanted to do now is leave plenty of time for question and answers. And also, if there's any pointed questions or guiding questions that we want to discuss, you know, maybe a Christian might know some of these answers that people been putting in the chat, is on the idea of multiple pinning, and also one of the other questions is of making sure that everyone can see everything else that's going on, the light, the camera. We've been having these discussions off the chat is all important. And so maybe, Christian, you can talk about that, because several of these issues have come up in the chat. The interpreter is not on.
I'm just waiting for him to complete a sentence. Give me 1 second, please.
Oh, and if you could turn your video on too, so people can lip read.
Okay.
I'm happy to answer the question. For multi-pinning, you've got to be able to present a presenter as well as an interpreter, and it becomes incredibly challenging, as was mentioned. The burden falls to the person with the disability to have to do so. So the the deaf and hard of hearing person who's participating has to go in and figure out how to pin all of these individuals to make it accessible for themselves. Going in, having to find these individuals, pinning them becomes a lot of work. And that's not an appropriate practice to use. And pinning is also not the best way to address the issue. In lieu of that, I suggest two options. As was mentioned, people taking videos off. There are too many videos on screen, and it makes it difficult to read and or understand sign language because of the number of tiles on the screen, and it becomes an accessibility issue. The second option that you have is that you can be made the host, or if you are a host, if you're hosting a session, pick someone to be the facilitator for said meeting, or to be the person who runs the spotlighting, so that the responsibility doesn't fall to the deaf and hard of hearing person. As well as there can be issues with video quality. You need a subject matter expert who understands how to make high quality videos, because that's what individuals are reliant on, and you need to make sure that you're training individuals how to follow the procedures that you're establishing for your online meetings. There are guidelines that exist. Having appropriate lighting, making sure that it's not coming from one side or another, but that people are appropriately lit, as well as contained in the video screen on camera in a place where you can see them. These practices aren't difficult to follow. However, it does become a challenge. I'm going to turn it over to Lydia as well as Mark to add in their comments as well. Mark, did you want to go ahead and make your comments?
Great. Thank you for those additional comments. Yeah, there's a lot of different issues that we're facing. First, who's paying for the interpreter? That's a big issue. The situation has changed, in terms of who is paying for the interpreters. In Europe, sign language interpreters have rates, established rates, for example, 1-day rate. But now that's changed. Interpreters now are establishing a 1-hour rate, and it's actually more expensive if you think about 1 hour's cost compared to a whole day's cost. And so now we're in the position of having to justify that cost. There are online conferences who are now looking to hire interpreters, and, they're completely shocked. They're falling over by how much they have to pay. They have to pay for not only one interpreter, 2 interpreters, and it's quite a cost. Different countries have different systems for how this works. In America, there is something called the FCC, VRS, and VRI. Those are agencies that govern these practices. Here in the European Union, we have different systems based on what country you are in. And a lot of deaf people end up paying for these services. So we talk about an additional burden. That could be an additional financial burden. You have to consider this. And many conferences will dismiss deaf speakers. They won't actually invite them because of the cost, the additional cost to their overhead. If we provide a deaf person, as a speaker, if we invite them to come to our conference, oh goodness, then we're paying for interpreters. Then we're paying for 2 interpreters. Oh, we have to pay for captions too. Let's just not invite them. We know that that's what happens. So we need a different approach. We need to be considerate of how we work together. Lydia, do you have anything you'd like to add?
Thank you, Christian and Mark. This is a really good discussion, and cost is an issue. We cannot avoid discussion about that. And, you know, in terms of remote captioning and the captioners in overall, it's a similar issue. So it should have been, especially for all day and like full day conference, we should have 2 captioners. So, you know, to make sure that they have away breaks and they are able to provide the quality of service. I actually had many times was discussions that one captioner is enough and it's okay. Actually, it's not. What happens if this captioner, for example, falls ill? You know, you can faint, you can feel unwell suddenly. There is a huge pressure just for one person to provide the support for the people attending different conferences. So that's one thing. Now in UK and USA, we are lucky. We are both lucky, definitely, when we are looking at ability to actually ask for this with different kind of degree. But I'm Polish, and I know that in Poland, it's really hard to actually get the captioner. Therefore, it's also another issue, an issue of training and developing the services, let alone actually seeing those services as professional services. So captioners are actually treated in the same way as sign language interpreters in the UK or USA. And we also in UK, we have a register of professionals. That does not exist in some countries. Many European countries do not have this kind of, development, in the captioning. So it is important as well. It's important to also understand that, yes, it's not only, in our case, it's not only, and I think same with interpreters, it's not only that some of them would not be available, for example, or they are too expensive. It took quite a huge effort for everyone to actually upskill themselves to be able to deliver services online, to be comfortable with it, and to find themselves in a completely new reality. So there's quite a lot going on. And yes, I still think that it will be a mixture in future, face-to-face and online, depending on what works in which situation. Thank you.
Thanks so much for this. So maybe I've got other questions here, but some of the questions, and maybe Kristen knows the answer to this. One person writes to me, how secure is the data, the captions on the stream text link or otherwise, and can it be hacked? Can people find out information about others? And so something like that, like for instance, people talk about at work, they're in a secure environment, that they have special VPNs, and now the stream text links may be open, and that could endanger or some of the safety or something like that. So maybe someone could answer that question. Yeah, Christian.
I'm happy to start. That's an excellent question, and I'm glad that someone was able to ask that. There is a way to be able to provide captions that are secured. And non-transmittable correction to the interpretation. With stream text, it's not. With stream text, it's not. It's for public events. So stream text is fine for any public event. If you're looking for something that's confidential, you're going to need to use another platform. And that issue of confidentiality has come up. There was a company that used another service called Recapped. I just typed the official name in the chat box for people to be able to see. With Recapped, that's a service that provides a back-end firewall in order to be more secure in terms of accessibility. So you can use that company. There's also another option out there where the captioner provides the caption and then someone shares their screen. So you can't copy that text because no one actually has access to the captions. So that provides a good option as well, but you should know that that wouldn't be accessible for those individuals who have visual impairments or who are blind. And I'm sure that, Lydia, you have some other options that you might want to add in terms of secure captioning services.
Can I add to that? Thank you very much, Christian. I'm sure this is a really valuable addition to how to work around the security issues. But there is another issue. An issue is coming up quite often as well, which is when deaf and hard of hearing people participate, especially in online events, which are much harder to manage cognitively than normally you would say face-to-face meeting and so on. They rely on being able to recap what has been said in the meeting to provide some kind of report back, for example, to the colleagues, which they need the transcript back. And often they might get refused to actually access to this transcript. So there is a conflict of, it's like, either we are trusting each other or we are not trusting each other. So there is a conflict here. How would you go about that?
Captions are really important for deaf and hard of hearing people. And security issues, yeah, they're major. For many meetings that need to be secure, we've used captions openly, you know, with the different websites and links. Christian, though, you bring up a really good point about the shared screen. One problem with a shared screen and just having that visual of the captions is you can't edit the captions. And I think an issue that we need to consider and now is the time. We don't want to delay this any longer. As Lydia said, we often want access to the transcript afterwards. And sometimes it's a matter of who pays for this. Some caption companies ask you to pay extra for a transcript afterwards. And then that begs the question, who pays? If I ask for a copy of a transcript and they say no, because you have to pay for that option, what do you do in that situation? And I think it's a good issue for us to look at in the future and continue to have discussions about.
Christian?
Right. I think that there are some very important comments that are coming up in the chat box feature. Gerard Williams has actually brought up a salient point. And I'd like to talk about it. So in face-to-face meetings, you often have two interpreters working together as a team. They will feed and or correct one another, monitor each other's interpretations. So now we have interpreters working remotely, and you've got one person speaking for another person. Maybe they miss something in the sign language interpretation. It's been a common practice amongst interpreters that they feed or correct those interpretations for one another. They're able to speak that in spoken English or sign to one another in order to have more accuracy within those interpretations. However, in an online world, it's different and they're no longer able to do so. For example, Sandra is on screen right now and she is my voice, but it becomes difficult for her because she has to understand everything that I'm signing on her own and ensure that she misses nothing along the way, which can become difficult, whereas the other interpreter has time and serves as the backup. In a remote world, it becomes a lot more difficult and challenging for sign language interpreters to work and team with one another. So that's another issue that needs to be handled. That's incredibly important. We need to give the interpreters everything we can content-wise ahead of time in order for them to prepare. It's not a perfect solution, but it is going to help quite a bit.
Mark?
I did want to add and perhaps ask, Christian Vogler talked about different types of platforms this morning that are in use. We all are familiar with Zoom, Teams. There are different platforms out there on market. And so people who are responsible for meetings are the ones who are making the decisions about which platform is used. WebEx is another platform. WebEx I found to be very difficult to follow. The point is, each platform is a new learning curve. You have to learn each platform. You have to learn its features, where the captions are. You have to find all of the different unique features to each specific platform. That's a unique experience. How can we control for that? How we want to be able to advise those who are hosting meetings about which technology platforms are the best.
Lydia?
I'm not going to answer this question, Mark, because I believe Christian has done a wonderful chart looking at all the different accessibilities. And I think, he will be the best person to answer which possibly platform is the best. But I would like to point out one more thing. I actually am quite lucky that I am living with my sons who are in their 20s. So any kind of issue I'm coming across, when my webcam wasn't working, when all the different things were going on in my computer, I could easily get at the earshot, just ask them to come and help me to sort it out. Imagine now someone who is not really so easily around all these different things. It is another issue we have to look at. But anyway, Christian, do give us some kind of pointers, and maybe we can as well incorporate it at NADP. Thank you.
This is Christian. Yeah, I think that the big challenge that exists here is that everyone needs to use the platform and they need to learn how to do so. Some people are very adept at picking up that technology, whereas others are not. And I'd like to give you an example of that. A lot of us know that Zoom is an easier platform to use, and we think that, but in fact, it is not the case. I've been on Zoom sessions with my mother, who's 79, and I'll set up a Zoom session to be able to meet with her so that she can see me as well as my kids, my twins, and my family. I want to give her the opportunity, so I send her the link to connect to the meeting. which automatically downloads the platform. It does everything for her. And even in that situation, she still struggled. She was confused about what she needed to download, what she didn't need to download. And she kept just looping herself back through this struggle cycle. And I could not help her because I couldn't see what was happening on her screen. She's in Germany, I'm in the United States. And so I was a little bit stuck as to what I could do. And it was really challenging. Another example is just this past summer, I was participating in an international summit. And for those who were remote, we were using Zoom, and there was one person who was really struggling to figure out how to manage, where to put the interpreter, how to have the screen share on camera. And I know that it's not easy, and it can be incredibly challenging for some individuals. And as we become older, our ability to pick up new skills and technology diminishes. Even those who are incredibly adept at technology, as they get older, it just becomes more difficult. So the concern becomes, what's happening with our older generation? What are they doing? Are they going to the doctor? Are they able to have telehealth appointments? It is a new world with this technology, and there is some concern. And we're just trying to figure out all of those issues so that they don't have to struggle through those moments, that we can make technology that becomes an accessible platform for them as well. We have to figure out how we can integrate both of those pieces, the user understanding as well as the accessible platform components. Mark?
Lydia, you're living with a two-man technical support team in your house. That's great. But this might be a question for the two of you, Christian and Lydia. Accessibility, no matter what happens, accessibility can be taken away, really, at any meeting. Let me give you an example of what I mean. Say you're accessing Zoom and you have your interpreter there ready. You've pinned everybody you need to pin. You feel incredibly prepared to start the meeting, and everybody, all of a sudden, someone shares a screen, and that changes the layout on your computer screen. Now you don't know where the interpreter is. Now you don't know where the speaker is. Now in Zoom, it's pretty nice. You can control the size. You can make the screen share bigger. You can make the interpreter bigger. You can control the size. In Teams, you cannot do that. The interpreter, if someone shares a screen, the interpreter becomes very small, and they're incredibly hard to see. GoToMeeting is the same issue. This issue is there, and it doesn't matter how experienced in technology you are. That control that you have is taken away by the host. And so, as Christian has said, the advice, what will we do in that type of situation? If I don't have control over the platform, and it's a platform that is audio-based, what would I do?
This is Christian speaking again. I have a really short answer to that. Work with the interpreter to set up a separate meeting, such as FaceTime or any other web platform. 3 weeks ago, I actually provided a presentation to a government agency, and that agency required the use of Teams as the video platform, and there was no other option. So in that case, I was able to set up a separate meeting with an interpreter so that we could see one another clearly. At the same time, I could make sure that the slides were shared. As I developed the slides for people to be able, the scripting for people to be able to read, I had 6 slides. And progressing through those. And I didn't speak while I was progressing through those slides. I just showed all 6 of them, then turned off the PowerPoint and began my presentation and recapped the content from those PowerPoint slides.
Thank you, Christian. And that's something that worked for you as one deaf person with the resources that you have. If you have perhaps 4 or 5 deaf people in a meeting, then it becomes even more difficult because you have 4 or 5 different individuals that need to be, accommodated. Often you can, I know that I've used an iPad in the past to call a VRS interpreter and then used my computer for content, but that raises further security issues. I would call an interpreter, for example, give them the Zoom link, and then the interpreter can join the meeting through that Zoom link. But people have objected to that. As soon as the interpreter joins the meeting, everyone wants to know who the interpreter is and who let that person in. And then it's my responsibility then to explain, listen, well, this is my interpreter. And then the comment comes back inevitably, listen, we can't see them. And I would say, well, this is how it's working. I'm using an interpreter on a different device. But it begs the question, why do deaf people have to justify? It's a real issue because you lose time in just that justifying. And so one solution can sometimes beg more questions.
I agree with you, Mark. And we shouldn't be the one actually shouldering all the responsibility for understanding the accessibility. I mean, what you are saying right now, in some ways, is similar to hard of hearing people have been coming across, and they still come across this, when they want to use, for example, assistive listening devices, FM systems. You come to the presenter or whatever, and you ask, or teacher, and you ask them to speak to it so you can hear them better in the lecture. And yet they are straight away going, oh, are you recording me, or and so on? So it's very similar kind of situation and clash suddenly. But I also had an experience with when the actual platform used is not in similar way where I can actually use my captioning, for example. I use the second one, which is stream text. And yes, sometimes I will use second device. Sometimes I've learned how to use it now alongside the actual platform. So it's about learning on those things. But we had a really interesting situation a few weeks back with someone related to, it was a government, I can't remember exactly what level it was the meeting, but the person who was chairing the meeting on Teams was unable to hear any of us speaking, but we could hear him speaking. And then suddenly he was put in the situation we are in, when we cannot hear anything and we have to follow captioning. For the first time, this person was put in our shoes and saw how important it is. But actually this was for them a backup, just as well. Otherwise, he wouldn't be able to continue with chairing the sessions. So, the accessibility is there to help everybody. Yet, like you said, we have some people objecting.
Thanks so much for these questions. We have another question from Alexander Hatchett. Oh, for some reason I can't. Jolly, can you unmute Alexandra? Because I can't seem to unmute her. Thanks.
Hello. Hi, I've just unmuted. Can you hear me okay? Because this is
Yes.
the first time I've used the computer. Thanks for letting me participate. I did put the question across to Christian Vogler. Thank you. I'm an audiologist. I'm hard of hearing. I work mostly with hard of hearing deaf patients that come to the hospital. And because, with this COVID-19, a lot of them are wearing masks, I sometimes misinterpret what they've said. So I thought it might be a possibility to use the live transcribe on my iPhone just to reaffirm what my patients have said. And sometimes if I misheard what they've said, I'll show my patient, is this what you've said? And they'll maybe say yes. So I asked my manager within the NHS Trust if it's okay for me to use this. And he said it might be an issue because of data protection. But as far as I'm concerned, it was to reaffirm, because I don't know any other way how I could do my job more efficiently if I can't hear what my patients are saying. I mean, I want to be independent doing my job, and I love my job. And I don't want to be taken away from my job because of the communication tactic. So I'm just wondering what everybody else's thoughts are. Thank you.
So Lydia, would you care to start and respond to that, or would you like for me to?
Thank you. Christian, you would be the best person to follow up from me, as you know yourself, because you have been involved in some of the areas of this work. Now, in UK, we have actually some of the medical doctors themselves very happy to download the actual live transcribe app and to use it. If you do not use the names of the person and all the different data kind of information in the discussion with your patient, I can't see how this can be seen as security issue, to be honest. Also because live transcribe use AI, so it's not like somebody is listening to it, and so it's not a third person in the conversation. But for example, there was not very long ago on the Twitter, which has gone viral in UK, there was a paramedic who was using the live transcribe and was saying to everybody how useful this app was to be able to support deaf people in the accident and emergency situations. So obviously there are people who are using it, and the question is about educating perhaps your manager, Alexandra, on how actually this app works and how it can be done, but there is a data protection respected. But I am over to Christian.
This is Christian speaking. Thank you, Lydia. I think that the fundamental problem is the recognition. The cloud is doing speech recognition, and all of that moves into the cloud and then comes back as text language. Google says they don't save that data, but that's not enough. If you want to use live transcribe, we need Google to confirm that they are complying with those medical confidentiality regulations. And right now they're not saying that. So part of that's the problem. And here in the United States, for example, if a physician wants to use live transcribe with a patient, it would be in violation of our laws and regulations, because again, Google has not confirmed that they are compliant with those regulations. I'm not sure what that looks like in the UK, but I'm sure that most countries contain some type of law relating to medical information and confidentiality. There's no easy solution here. Maybe for deaf and hard of hearing individuals, we need to work together with medical providers in order to all come together to Google and convince them to be compliant with that legislation, or be able to provide them with options. In the reverse situation, if I were a patient and I were visiting a physician, I always bring live transcribe with me. And I can do so because I make my own decisions around my own confidentiality. So it's a little bit different as a patient. However, Alexandra, in your situation, you are the physician, you are the audiologist, and that's a difficult situation. One thing that I've noticed is that here in the United States, what the audiologists are doing is setting up a video conferencing at their hospital, where I'm in one room, the audiologist is in a separate room. We have a telehealth appointment. And if you're in separate rooms, then you can remove your mask. And then communication becomes easier. It becomes easier for you to be able to speak with that person. So maybe setting up 2 rooms that have those telehealth options where you can remote in the same setting, but different rooms, and remove your masks.
Go ahead.
Yeah, Alex, go ahead. Oh, you're unmuted. You're muted, so let me. Can you unmute yourself?
Yeah, Monday. The problem is in the UK where I work for the National Health Service. There's lack of resources. We don't have enough room. I may as well work from home asking the question. But the idea that I see my patient face to face, asking them all the medical questions, then I can go ahead and fit them with the hearing aid and hearing test. That's my problem. I'm on the other side of the coin here, but I'm just wondering for your input. Thank you.
Thank Christine.
And one thing that I would just add is that there are some companies that do sell clear masks where you can read and still see people's mouths, and that can be used for your patients as well, the clear mask.
Locke?
Thank you. Google Live Transcribe would often say, you know, that this is a good product to switch to captioning from speech to caption. And so we don't have to think only about Live Transcribe, right? Aren't there others?
Christian?
Yes, there are other products out there. Within the deaf and hard of hearing community, I would say that there are 3 or 4 specifically: Live Transcribe, AVA, AVA, Otter AI, OTTERAI, and MS or Microsoft Transcribe, or Microsoft Translate, correction to the interpretation. So those are some options to use as well.
Thanks so much. I can't believe it. We are coming to the end of the panel. I think this is an amazing panel. I'm so glad we have this. I do want to give a plug for the Internet Society Special Interest Group. We're called Accessibility SIG. You can either find us on the web at accessibilitysig.org or at a11ysig.org. And stay tuned for our, we're going to have some closing remarks by our president, Mohammed Shabir. But stay tuned and join our lists. Well, I'll post the information in the chat. We do have a little, if you're not a member of the Internet Society, it's a little bit trickier because first you have to join the Internet Society, which is free, and then you have to pick your special interest group or chapter. So it's a two-way thing, which we've always been trying to simplify. Also, with us, we have a little bit addition is that we're trying to, when you join us, we don't want to accept everyone without knowing a little bit about them. So we have a form that you need to fill out. And so we ask you to fill out this form so that we can gather some more information about you and then accept you. So there's a multi-step process, but we our next event, we might have our next event is on December 3rd. And it will be a new rollout. ISOC, Internet Society, and our group has designed an accessibility toolkit, which is in the second revision. and that the president and CEO of the Internet Society, Andrew Sullivan, will be here at a friendly time for trying to be almost friendly time for all reasons. I know Asia Pacific is not so friendly, but it's going to be at 2 p.m. Eastern, which is 1900 UTC. Yeah. And so we welcome you all to come to that event and also to sign up for our list. And so that you can find out many more events that are happening. We love you. And I wanted to turn this over to Mohammed Shabir to give our closing thing. And Shabir, also, could you turn on your video? Thank you. Shabir, are you there? Jolly, could you make sure he's unmuted? Ah, Shabir, I see you. I think you have to unmute yourself now. It's a double unmute thing. Jolly, can you help him? Shabir?
Judith?
Yes.
Judith, am I audible?
Yes.
now? Yes, thank you very much, everyone. And frankly speaking, after this very healthy discussion, I don't have much to say, except for to thank everyone who participated in this very interactive webinar. There were many things that we learned from today's discussion. And if there was one thing I were to pick, I would really pick the remarks from Christine's speech, that it's 80% behavior and 20% the technology that makes your meetings accessible. And if the behaviors do not change, technology is just a tool and it cannot make your meetings accessible. So, ladies and gentlemen, I thank to all the three panelists, Christine, Lidia, and Mark, for their very valuable inputs to this discussion. I also thank to Gallaudet University for their support in sign language interpretation. My thanks to Judith Hellerstein for moderating this webinar and also doing a lot of secretarial and technical work for the preparation of this webinar. Thanks are also due to Jolly McFly, the Accessibility SIG admin, who has been doing a lot of work for us to advertise and promote these meetings. He also does a lot of technical work for us. And if you want to join Accessibility SIG, you just need to fill in a form, and thanks to Jolly, he does the rest for you. So you just need to go on to accessibilitysig.org/join and fill in a small form, and Jolly will fix your membership up. Ladies and gentlemen, Judith has already highlighted and informed you about our upcoming webinar that we would be having on 3rd December on the day of International Day of Person with Disabilities, where we would have the honor of listening to Andrew Sullivan, the CEO and President of Internet Society. One small message and request to our community, our members and community people who are deaf or hard of hearing. In the membership form, we have a small question that which sign language interpretation they would prefer. Unfortunately, we cannot have multiple sign language interpretation due to the lack of funds, but we would like it to keep as democratic as possible. So we are asking public what they want. So if you are a person with hard of hearing or belong to deaf community and interested in joining this webinar, please, please fill up this form before 23rd November and let us know which sign language interpretation would you prefer. And based on the poll that we would have on 23rd November 23:59 UTC, we would decide the sign language interpretation for the webinar. Thank you in the end, everyone, for joining us, and stay tuned to more webinars such like that. It's you who make these webinars accessible. Thank you.
Thanks so much, Shabir, for your leadership. And your, Shabir is calling in from Pakistan. So we are truly a global organization. We have leaders, actually, we're mostly Asia Pacific and US based from our leadership, but we have members all over. And so we look forward to, and if you have any ideas what you want to see in a session, right now under this current grant proposal, we have 2 other sessions left to do. Besides, the December 3rd is not included in that. So if you have some other ideas, do let us know, because we will be happy to do it. We have some other thoughts about working with other Internet Society chapters on this, of doing some other regional or other events, but, you know, please do let us know. And because we, as the year starts, we are going to apply for a new grant and have new ideas. So, but just give us your ideas, and thanks to all for coming. And for people who might be in the Pacific region, we are tentatively having an event at the end of the month, but they haven't firmed it up. With the Pacific, it would be with the Pacific Island chapter of the Internet Society, along with the Disability Fund in the Pacific. So please do let us know, and I thank you, and I'm sorry I've now gone like 1 or 2 minutes over, but it's been a great discussion, and so I wish you a good day, good evening, and good afternoon. And maybe some places good morning.
Bye, everyone. Thank you.
It was quite fun. Thank you.